Okay, so you know how we always dive into these fascinating collections of information, right?
Right.
This time, you've really outdone yourself.
Oh, thanks.
I mean, we've got Dr. Biswas' fresh perspective straight from the Asia-Pacific Academy of Ophthalmology Congress.
Mm-hmm.
Plus, these really impactful local stories about the challenges people with diabetes face right here, right now.
Yeah, it's a powerful combination.
It really is. And there's this sort of underlying thread running through everything.
Yeah.
It's this connection between diabetes and our eyesight. You know, a link that often doesn't get the attention it deserves.
Right.
I mean, we all know India's got this, unfortunately, this title of being the diabetic capital of the world. But when you start to grasp the sheer scale of what that could mean for people's vision,
It's pretty alarming.
it is. It's genuinely startling.
Yeah, and going through all the material you sent, it struck me how Dr. Biswas, and this was echoed in those local stories, really stresses that this isn't just about keeping your blood sugar in check.
Right.
It's about actively protecting your vision.
Absolutely.
Because when we talk about how many people in India have diabetes,
Oh, it's staggering.
it is. Those numbers from the ICMR India B study, over 101 million diagnosed, and then another 136 million teetering on that pre-diabetic edge.
Wow.
We're potentially looking at this massive wave of eye problems if we don't get ahead of it.
Yeah, you're absolutely right. And something that really jumped out at me was this idea that diabetic retinopathy, or DR, it's not some distant risk.
Yeah.
It's a very real and present danger.
Right now, for so many.
I mean, think about it. This condition, it attacks the eyes of people with diabetes. It's one of the main causes of preventable blindness.
Preventable blindness.
And it's not like a gradual fading of vision. It can be permanent vision loss.
It's a real wake-up call.
Yeah, it's a powerful reality check.
Something Dr. Biswas really emphasized, and it's concerning, is the age group we're seeing with these new diabetes diagnoses. It's shifted.
Not just older folks anymore.
Not primarily, no. Most new cases are people under 50. And studies are showing that a shocking 70 to 80% of these younger folks are likely to develop DR in their lifetime.
That's
A huge chunk of the working population
That is a huge jump.
facing this serious threat to their sight.
It really makes you rethink how we approach this whole issue, doesn't it?
Definitely.
It's not just about numbers on a page.
Right.
It's potentially millions of people
Yeah.
in the prime of their lives,
Right.
facing a future where their vision's impaired or they've lost it altogether.
It's heartbreaking.
And to add to that, the data shows about 1 in 3 people with diabetes will develop DR. And if we just look at adults over 40, that number's already around 12.5%. When you consider India's population, we're talking about millions of eyes at risk.
Yeah.
Millions.
And the tragedy is, as Dr. Biswas pointed out, so much of this vision loss can be prevented.
Right, right.
Early detection, that's the key. Timely intervention. I mean, his words really hit home. The earlier we intervene, the better the outcome. Wait too long, and it's game over.
Game over.
Irreversible damage. No rewind button. It's blunt, but it gets the urgency across.
Yeah, it really does. So let's break down what's happening in the eye when diabetes starts to, well, do its damage. It's
Yeah.
not like sugar's literally clouding up our vision, right?
Not quite like that. Think about the back of your eye, the retina.
Okay.
Super intricate.
Mhm.
It's got this network of tiny blood vessels,
Okay.
like delicate little highways delivering oxygen and nutrients. That's what lets us see.
Right.
High blood sugar over time, it can damage those fragile vessels.
So how does that damage actually show up? What's the chain reaction?
So those high glucose levels, they can weaken the walls of these tiny blood vessels, make them leaky.
Okay.
So fluid and blood seep out.
Oh, yeah.
Sometimes those vessels get completely blocked, cutting off vital blood flow to the retina.
Wow.
And that messed up blood flow to the retina, that's what causes the vision problems. People might start seeing blurry patches, those floaters, little things drifting in their vision.
Yeah.
And in more advanced stages, well, you can have serious vision loss.
Right. And then there's diabetic macular edema, or
Yeah.
DME.
Right.
The reports you sent mentioned that as a particularly serious issue. How does that factor in?
DME, it's a specific complication of diabetic retinopathy, and it's serious.
Okay.
The macula, it's this tiny spot in the center of your retina,
Right.
but it's crucial. It gives you that sharp central vision. Like when you read or recognize faces
Okay.
with DME, fluid builds up in that crucial area.
Because of the damaged blood vessels.
Exactly. The damaged vessels leak, the macula swells, and your central vision takes a hit. It can decline really fast.
Wow.
Dr. Biswas noted that about 10% of people with DR develop DME. So yeah, it's a big threat to clear vision.
Okay, so knowing all of this, what are the treatment options? I remember Dr. Biswas was talking about a real shift in how DR is being managed these days.
Oh yeah, the treatment landscape's changed dramatically.
Hmm.
Older laser therapies, they still have their place in some cases, but the real game changer, as Dr. Biswas put it, is intravitreal injections. He was really excited about this.
Intravitreal. Sounds pretty intense. How does that work?
So it involves injecting medication right into the vitreous humor. That's that gel-like stuff inside your eyeball.
Uh-huh, okay.
The drugs they use, often these anti-VEGF medications, they target the root of the problem in DR. They help stop the growth of abnormal new blood vessels that can form in the retina,
Okay.
and they reduce leakage from the damaged ones that are already there.
All right.
So it can actually halt the progression of DR,
Right.
and importantly, can often improve vision, especially with DME.
That's incredible. But one of the biggest issues that came up in all those sources you sent was the cost of this treatment.
Oh yeah, that's a huge barrier.
A huge barrier.
Intravitreal injections can be a lifeline for preserving vision, but the cost
It can be a lot.
can be out of reach for so many. Dr. Biswas pointed out that a single injection, depending on the specific drug, can range from like Rs 6,000 to Rs 60,000.
That's a lot.
That's a lot. And you might need multiple injections over time. Right.
So it becomes this enormous financial burden.
It's almost like
Marking, right?
you've got this treatment that can save your sight, but you can't afford it.
Exactly. And the current safety net, the coverage for this essential treatment, it's just not enough. Dr. Biswas really stressed that point. Only the CGHS, the Central Government Health Scheme, and a few states cover these injections.
Right.
So that leaves a huge number of people
With no help.
with no help, no financial assistance for a treatment that could prevent them from losing their sight.
Especially during their working years, yeah.
And that's why Dr. Biswas was so adamant about government intervention. He really pushed for including DR treatments under Ayushman Bharat.
You feel strongly about it.
Yeah. His argument is treating diabetic retinopathy, including these advanced injections, shouldn't be a luxury. It should be an essential healthcare service.
Right.
Preventing blindness during people's most productive years, that has huge economic and social benefits.
Yeah. Way more than the cost of treatment. It lets people stay employed, support their families, maintain their independence.
It just makes sense.
Yeah.
Imagine, say, someone in their late 40s, maybe they run a small shop or have a really demanding job, and suddenly their vision starts to blur because they have undiagnosed diabetes.
Oh, that's tough.
It is tough. And then to think, there's this treatment that could help them,
Right.
but they can't afford it.
Yeah, that's
But-
crushing. It is. And this problem, it's only going to get bigger. Projections show a significant increase in diabetes cases in India by 2045.
So more DR as well.
Exactly.
Yeah.
If we don't have effective prevention and treatment strategies now,
Yeah.
we're going to see a surge in diabetic retinopathy.
And it's that working age group, that 20 to 60 age range, they're the ones most at risk.
Yeah.
And the ripple effects of widespread vision loss, they go way beyond just the individual.
They do. It affects families, communities, the whole economy.
Right.
The economic burden of blindness is huge.
Yeah.
You've got lost productivity, increased healthcare costs, social welfare costs.
That's a lot.
That's why Dr. Biswas was so passionate about early detection. He called it our superhero.
Oh, superhero. Okay, so if getting access to advanced treatment is such a hurdle for so many, what can we do on a larger scale? Regular eye checkups? I mean, that seems like the most basic first step.
They are absolutely crucial.
They are.
Routine, comprehensive eye exams, especially for anyone with diabetes. But what's equally important and often missed is screening for people who might have diabetes but don't even know it yet. Remember that stat. Over 57% of people with diabetes in India are undiagnosed.
It's crazy.
It is. And in the early stages, you often don't have any noticeable symptoms of DAR.
So even if your vision seems okay.
Get those regular checks.
Got it. The reports also talked about these screening camps. How effective are they at reaching more people?
They're vital, especially in areas where specialized eye care is hard to come by.
Yeah.
Dr. Biswas described the process. Quick, painless, they use portable tech to examine the back of the eye,
Okay.
looking for those early signs of damage. Right.
If you can catch it early, you can get referred, get treatment, have a much better chance of keeping your vision.
It makes a huge difference.
We call them sight-saving events.
Yeah, that's a good way to put it. But how do we get the message out there? How do we encourage people to get screened, especially those who don't even realize they might be at risk?
That's where public awareness campaigns come in.
Right.
That high percentage of undiagnosed diabetes, it's a major obstacle. We need a real combined effort. Healthcare providers, public health organizations, community leaders, even media outlets.
Everyone working together.
We need to educate people about the risks of diabetes, the importance of regular blood sugar testing, and that crucial link between diabetes and eye health. The message has to be clear. It has to make sense for different cultures, and it has to reach different communities.
Right. So for those of us listening right now, what are the key takeaways? What should we be doing?
If you have diabetes, or if you're at risk of developing it,
Make regular, thorough eye exams a non-negotiable part of your health routine.
non-negotiable, okay.
And even if you don't have diabetes, understanding this connection, spreading the word to your family and friends,
Yeah, that's important.
that can make a real difference.
Dr. Biswas also talked about lifestyle changes, how those can play a role.
Yeah, he drew a clear connection between managing blood sugar through lifestyle and reducing your chances of developing diabetes and those eye complications. His advice was pretty simple. Cut back on sugary foods, get some regular physical activity.
Makes sense.
It's not a foolproof way to avoid diabetes, but it can really lower your risk, and it's good for your overall health, too.
Right. So we've covered a lot of ground here, a really important health issue.
It is.
Diabetic retinopathy is a real threat, especially for those in their working years. And even though we have effective treatments, access is still a huge problem.
It is.
Early detection and awareness, those are our best weapons in this fight against preventable blindness.
You got it. The potential for preventable vision loss on this scale, it's a serious concern.
It is.
Dr. Biswas's insights really highlight how urgent it is to tackle this issue head-on.
Yeah.
It's going to take a multi-pronged approach. Increasing awareness, making screenings more accessible, making sure effective treatments, like those intravitreal injections, are affordable and available to everyone who needs them.
It makes you think about the kind of healthcare system, the kind of society we want to build. One where this level of preventable blindness,
Yeah.
it's just not acceptable.
It shouldn't be.
It shouldn't be.
It comes down to this. Do we accept a future where millions of people lose their vision needlessly? Or do we actively work towards a future where early intervention, equitable access to care, those things protect people's sight, their livelihoods?
That's the question, isn't it?
It is. The answer, I think, lies in collective action. Individuals taking charge of their own health, healthcare professionals spreading awareness and providing great care, and policymakers
Right.
making this a priority.
A public health priority.
Absolutely.